Hey, I wanted to let you know where I'm at here. LDS Hospital, inside the apheresis room. This is where they collect blood samples for people who are dealing with blood and bone marrow transplants. And here's the reason why this is important. Because of the work they're doing here in this room, they're saving lives today that they couldn't maybe 5 or 10 years ago. Here, I'll let you hear about it here from Dr. Peterson, runs the program here. How does that work, Dr. Peterson? You're saving lives today because of this room.
That is correct. We've been saving life all along, but we've not been able to save a majority of patients who need a transplant alive because they didn't have a donor. So within the last 5 years, a technology called haploidentical transplants have been developed to safely do transplants for basically any family member that shares at least half your tissue type, meaning children, parents, many siblings, even cousins and nephews may share. And in essence, it means that we can now transplant more than 95% of patients who need a transplant, whereas in the past it was closer to 50 to 60%.
Wow, so you're really increasing the chances for survival of people who have leukemia, people who need blood or bone marrow transplants.
That is correct. So a patient like Mr. Young, who did not have a matched sibling donor that could donate, didn't have a matched unrelated donor that was compatible enough, the technology allows us to use one of his children, and we used his son as the donor for his procedure.
All right, and we're going to meet Mr. Young here in just 1 second, but explain to me kind of what actually happens here in this room.
So in this room, on the day of the transplant, the donors will come in and have their blood stem cells harvested out of their circulation, and that will be put in a bag and then brought to the patient's room, and we will infuse it into the patient's circulation in that room after some complicated preparations.
All right. So obviously it takes a lot to be able to get these patients to recover. We want to meet this guy, Mr. Young. Here's David Young, who's sitting down here in one of the places where you'd probably get some of that blood taken out, treated. You're obviously a patient who's surviving because of this program. Tell me, what was your situation?
I was diagnosed with acute myeloid leukemia, and I was able to get into remission so that I could have the transplant. And my son Ryan was the donor, and he donated the cells in this very room.
Oh, so we're sitting in the actual place where this happened for you.
Yes, he donated it here, and then they brought it down and they infused it into me. And we were able to sit and watch the blood run into me, and you could actually see the little cells, and it was an amazing process. It was probably harder for the donor than it was for me.
Because they're pulling the blood out of them and then pumping it into you.
However, I was very sick. They brought me with the
They came over here and they wanted to make sure that you were taken care of.
Yeah, with the chemo, they brought me down and so that my body would accept the new cells.
I see. And what's life been like for you now after you've had this treatment?
It hasn't been easy, but I've had a support group that has made it my wife and my family and my son Ryan. If it hadn't been for them, I wouldn't be here today.
All right, and we're glad you are here today.
And I'm doing great. I really am.
You look great. And if you want to check out this program yourself, obviously we're talking with one of these patients who's benefited from this bone marrow and blood program here at LDS Hospital. If you want to learn more information, we've got all of it online at goodforutah.com. We're right back.